Okay, hello, welcome to my channel. So this is quiz 2. Okay, anatomy and physiology quiz 2. Of course, you need to answer the all of the questions. And if you are watching quiz 2, you haven't watched quiz 1, you have to go back to quiz 1. Then you come back and now watch quiz 2. Okay, because we are moving in the where we were learning the anatomy and physiology lectures. Okay. So quiz 1 is about the first things, the introduction and what followed after introduction. Then quiz 2 is mainly about the skeletal or system or the locomotor system. Okay, that's quiz 2. So which of the following statements is true concerning a typical cervical vertebra? A, it has three sides on each side for articulation with the ribs. All cervical vertebrae have on odontoid process. Then the first cervical vertebra is called an atlas. Then typical T vertebrae articulate with one rib only. Okay, so you have gotten maybe a pen and a paper where you'll be writing down maybe your attempts. So before I show you the answer, then you mark yourself just to say how many you are going to get correct. Okay, so the answer for this question is C. So the first cervical vertebra is called an atlas. Okay, so feel free to pause the video before I tell you the answer. Okay, so let's go to question. Okay, so which of the following bones it's supposed to be is not a bone of the appendicular skeleton? So ilium, the femur, the sacrum, and the calcaneus. So which one of the not a part of the appendicular skeleton? So for the answers for this one is of course the sacrum, which is not part of the ilium. This is the axial skeleton. Then which of the following bone is the first to start ossification? The ulna, clavicle, scapula, humerus. Okay, so which one is the first to start ossification? Okay, so for the answer for this one is of course the clavicle. The clavicle is one which is the first to start ossification. Go to question 4. So which of the following bones is a sesamoid bone? Of the talus, navicular, patella, and the calcaneus. Okay, so this was asking about the sesamoid bone. Which one is the sesamoid bone? So here the sesamoid bone is the patella. Okay, since I've gone over 4 questions, you should at least get half of the 4 questions. So meaning that you should at least get 2 questions correct. Okay, so the following are bones of the hip bone, except the following are bones of the hip bone, except A, the ilium, B, the pubis, C, the ischium, D, the sacrum. So the following are bones uh, of the hip bone, except. Okay, so let's continue. So the answer here is D, which is the sacrum. So the sacrum, of course, is not one of the bones of the hip bone. Okay, so let's continue once again. So which of the following ribs is a true rib as well as typical rib? So rib 1, rib 3, rib 9, rib 12. Which one is the true rib and it is also a typical rib? Okay, then the answer for this one is of course rib 3. Rib 3 is a true rib and as well as a typical rib. Okay. Then which of the following ribs is both false and typical rib? Okay, it's false and it is a atypical rib. Okay, then you have rib 8, you have rib 9, rib 10, and rib 1. So which one is the false rib and it is atypical? Okay, so the one which is false and atypical from this side is the rib 10. Okay, where is certain rib X. Okay, then the following features are present on a typical rib. except, okay, so the following features are present on a typical rib, except A, the head, neck, costal cartilage, and the costal groove. Okay, so which one is absent in short? Okay, so the one which is absent, of course, here is the costal cartilage. This is not a feature on a typical rib. Okay, then which of the following is the other name for the jugular notch? Okay, is it the manubriosternal joint? This is the suprasternal notch. This is the xiphoid process. It's the angle of Lois. Okay, so which one is the other name for jugular notch? Okay, so the other name for jugular notch is suprasternal notch. Okay, then which of the following joints is the fibrogenous joint? So joint between the rib 1 and the manubrium, the xivosternal joint, the manubriosternal joint, or the interchondral joints. Okay, so which one of the following joints is the fibrocartilaginous joint? Okay, so for this one specifically, if you remember your joints lecture, you are now going to know that the interchondral joints are the fibrocartilaginous joints. Okay, then which of the following joints is considered to be the largest synovial joint? Okay, which of the following joints is considered to be the largest synovial joint? We have the hip joint, knee joint, shoulder joint, and the elbow joint. So I think this is also one of the easiest questions we have here. The answer, of course, is the knee joint. The knee joint is the one of the largest, considered the largest actually synovial joint. Okay. Then which of the following functions of the skeletal system is mainly offered by the skull? A. Support. B. Movement, storage of calcium, protection of vital organs. So function of the skull. Okay, we mean which one is the function of the skull here? Okay, so the answer is of course the protection of vital organs, specifically the brain and other parts of the skull, such as even the eyes. Okay, then we have question 13. So which of the following terms best describe a depression on a bone? Okay, which of the following terms best describe a depression on a bone? Is it a fossa, foramen, tubercle, or the tuberosity? Okay, so a fossa on a bone, a depression on a bone, sorry. So of course the answer was a fossa, so that's why I said the fossa on a bone, which is a depression on a bone actually. Okay, so I think let's move. Okay, so which of the following bones of the skull is unimpaired? Okay, which of the following bones of the skull is unimpaired? The sphenoid, the maxilla, the nasal, and the palatine. Okay, which one is unimpaired? Okay, so the one which is unimpaired is the sphenoid bone. It is unimpaired. Okay, then which of the following ribs has both the neck and the tubercle? Rib 1, rib 10, rib 11, rib 12. Both the neck and the tubercle. Okay, so which rib? Okay, so here the answer is rib 1. So rib 1 has both the neck and the tubercle. Okay, then how many joints does a typical vertebra make with its adjacent vertebrae? 3, 4, 5, 6. Okay, so this is one of those questions. If you know, you know, and if you don't, you don't. Okay, especially if the question is asking about the number and you sure don't know the number and you have never heard about the question, then guessing is kind of hard. Okay, so here, of course, the answer is 5. So the typical vertebra has 5 uh, has 5 joints. It makes with its adjacent vertebra. Okay, then the longest bone of the upper limb is there. Well, this is also one of the easiest questions here. You have one, the humerus, the radius, the ulna, and the clavicle. Okay, which one is the longest bone of the upper limb? Of course, it's a humerus. Okay, then which of the following joints is a zygopophysis? zygapophyseal joint. Zygapophyseal joint. So A, the joint between the vertebral arcs, the joint between the two vertebral bodies, the joint between the transverse process and its own rib, the joint between the elatrus and the occipital bone. Okay, so which one is the zygapophyseal joint? Okay, so the answer for this one is A, which is the joint between the vertebral arcs. Then the foramen magnum is located in the dash. Is it in the sphenoid bone, temporal bone, parietal bone, or the occipital bone? Okay, so where is it actually located? So the foramen magnum. Okay, it is located in the occipital bone. Okay, that's where the foramen magnum is located. Okay, then which of the following bones is an irregular bone? A, the rib, vertebra, femur, or the clavicle? Okay, which of the following bones is an irregular bone? Rib, vertebra, femur, clavicle. So here the irregular bone is the vertebra. Remember, ribs are not irregular bones. Okay, they are flat bones. Okay, because most people may go for ribs as an irregular a bone. Okay, but it's not. Okay, or even the clavicle even. Okay, so I think that's the end of the MCQ questions. We are going to talk about the labeling section or the labeling question. So this one was of course saying you should label all the parts. Okay, so we have the synovial. This is actually one of the synovial diagrams. Okay, the synovial joint specifically. Okay, so of course it's not only the synovial joint, it has its other layers. Okay, but this is one of the synovial joints that we have. Okay, so you are told to label the parts. So okay, part A, this is a periosteum. So this is the periosteum. That's part A. Then part B, as you have seen, it is anchoring bone to bone. So that's a ligament. Okay. Then part C is pointing within a cavity. So it will be called a joint cavity. Or even if you put synovial cavity, I may actually have to mark you. Okay, because you are right. Okay, so joint cavity, but it's better you just call it a joint cavity. Okay, or synovial cavity, it's okay. Then D is the articular cartridges or the articulating cartridge, it's okay. Okay, articular cartridge or articulating cartridge. Then E is the fibrous capsule. E, fibrous capsule. Then F is the synovial membrane. F, this is the synovial membrane. Okay, then G, that is the articular capsule. So meaning the synovial membrane and the fibrous capsule together, they make up the articular capsule. Okay, if you combine the area between these two, that's the articular capsule. Then D is the articular cartridge. Okay, hope you have made sense out of this same thing we're talking about. And was the last question, of course. So that was the last question. And if you have any questions, you can ask in the comment section and share this video to people who it is going to benefit. Okay, so therefore let us all encourage one another and build each other up, just as in fact you are doing. Okay, so thank you for watching. If you haven't subscribed, please subscribe and hit the bell notification, and see you on the next tutorial.